So you're implementing a hybrid, and we've kind of talked about it, and you're implementing a completely home-based program. So can you just, I guess you can give us like a high-level overview of the workflow. So let's go from meeting patients, maybe bedside, to coaching them. How does that work for you? And then for Anne, it'd be good to also do the same thing in terms of patient comes to an orientation. What does the program entail?
So we bring them in for an intake visit, and it usually takes probably about an hour. We've gotten it down from an hour and 2 hours to an hour and a half to now about an hour. And we set them up with the technology, and we determine, we do a 6-minute walk with them, vital signs, and kind of determine where their level of fitness was, what they were doing prior to coming to us, and also looking at their diagnosis. And then we send them out with an exercise prescription, a resistance band, and a book, an education book, and set them up for weekly phone calls. And we do that for about a month, and then we go to every other week after that for the next couple of months, and then they get to have access to the app for the rest of the year. And we'll be calling them about once a month after that. Anything else?
Yeah, so let's talk about ITPs, and how do you do an ITP in home-based cardiac rehab? How does that work?
So we've worked with Moving Analytics to get an ITP that we have patients fill out several forms like a PHQ-9 and a GAD-7, and how much social support do they have, and rate your plate. And we have gotten it so that we can put all that information into Moving Analytics, and then that will generate most of our report for us, our ITP, except for even heart rate, target heart rates and stuff we've got in there, so it's nice. And then we take that document and pull it into Epic. And so, and then we send our ITP off to our medical director, and then send 30, 60, 90-day reports to her as well.
Cool. And one more question is, what is a home-based cardiac rehab session for you? What does that conversation look like with the patient?
We're checking in about whether, how did exercise go? Did they exercise? How long did they do it? Did they have any symptoms with that? We do the diet coaching in the first phone call, actually, so second visit with them, and kind of come up with some goals that they can make around their diet if they need to. Most of them need a few goals, but a lot of them are really have made a lot of changes already. And then we check in about whether there's anything going on with them as far as stress or depression, anxiety. Are they taking their meds? Any problems with those? Side effects, and then we just kind of, if we need to, we interface with our physicians on that, and we just, that's kind of the basic pattern for most calls each week, and try to encourage them if they're falling off their exercise, because sometimes after a few weeks they're kind of they get a little busy, they get back to work and they aren't exercising quite as much, so you have to kind of just get them back into it.
Sure. And one question I always get asked all the time is, how do you make sure people are actually doing the exercise? Like, the Fitbit, they can probably put it like on the dog or something. Mm-hmm. So how do you actually make sure that they actually do what you tell them to do?
I just, I ask them what it is they're actually doing, and then they do report, we get them to report resting heart rate and peak heart rate, and so that information is there. And it's really, I guess they could make that up, but that's a lot of stuff to make up. So I think most of them are actually doing it. But if you see them start to drop off on reporting on that, then you do have to it's a kind of a red flag. You have to get them back in a little bit. So.
Cool, that's really helpful. Thank you for sharing that. So, and let's talk about your own program and how that works. From how you even introduce this to patients to the day-to-day.
So since, again, we're a hybrid program, so generally the conversation starts we do group orientation once a week. So when we have that group of patients and we're doing our presentation, one of the things we talk about is the opportunity to use remote technology, and we offer it in 3 different ways. We say, if you're ready to start and you don't have a long wait time, you can still enroll in Moving Analytics, and you can use this as a means to report back to us what you're doing on the days that you're not coming. And it also helps with some people in motivation to continue what they're learning at the center. The other opportunity we give them is if there is a long wait time and they can commit to, we started out with Saturdays actually, if they could commit to a Saturday morning time, they could start right away. We would sign them up for Moving Analytics. They would come on Saturdays until their preferred time opened, and then they would be allowed to transfer into their preferred time. The third opportunity was to, if they had high co-pays or work restrictions or transportation issues and they couldn't commit to more days than once a week, they could just continue with 1 day a week for the entire program. So those are the three options that we provide. We give them a form at orientation, and if they're interested in any of those, they complete the form, and then our coordinator, I guess if you will, contacts them via email, tells them a little bit more in detail about the program, and signs them up for the program. So that's kind of how our flow goes. Outside of that, I would say that our assessment and goal setting and follow-up is really just what we do in our traditional program. I would say that their 1 time a week visit pretty much mirrors what you do on the telephone. It's just that it's face-to-face. So that follow-up with them as far as what are you doing for exercise, are you having any challenges with smoking or nutrition or behavioral kinds of issues, we discuss that face-to-face generally, or they can, of course, communicate through Moving Analytics. And then their dietary consultation or any of the other referrals, diabetes or whatever they need, they generally would do face-to-face instead of on the phone.
Sure. So I guess for you, what's the expectation? So patients are still coming back, they do that 1 session, they still do the exercise. What is the expectation of what they're doing at home through the app?
When they have their initial consultation, I guess I missed that part, but after group orientation, we still do a one-on-one initial consultation. So at that time, besides reviewing all of their assessments, they are given their exercise prescription, and that's discussed. So part of that discussion is, that your exercise goal is not to come 1 time a week, but, to also do your home exercise. So that exercise prescription discussion includes the expectations and goals, and then they are reporting in that, obviously, through their remote technology.
Cool. That's helpful. Thank you for sharing that.